Right. Which of the following structures is most likely affected in this patient? 70-year-old man with a history of hypertension, smoking, developed sudden vision loss in the left visual field of both eyes. All right. Physical examination confirms left hominis hemianopia, macular sparing. Okay. Okay. It's so funny because I had something similar to this night. Last night I had one that was right-sided. So I'm wondering if it's LGN. Let's see. Does it say which? No, it doesn't give a chart. I'm trying to think of it. Left. It's just the whole left side to be left, left. I feel like optic radiation has something to do with optic nerve, which I like, but then I don't think that would be the one with macular sparing with the circle in the middle. So I would take that. I'd take it as optic tract. I'm really not sure. These I get confused with. It's left, left. I'm really not too sure.
Okay.
Hmm.
What's your gut say here?
Hmm. It could be the Kivin. I know that Kivin goes to the opposite side. And he has hypertension. Maybe LGM, but I don't think it's correct. I don't know
Okay.
what it is.
Okay, so let's kind of figure this out together. So
Okay.
sudden loss of both eyes with macular sparing is consistent with a lesion in the primary visual cortex with the occipital lobe. Primal visual cortex receives input from the contralateral visual fields, and macular sparing occurs due to the dual supply from the posterior cerebral and middle cerebral artery.
Okay.
But if you have a optic chiasm, right, that's bitemporal hemianopsia, right? So that's the lateral side of each eye, okay, which is the temporal vision.
That
Optic,
makes sense.
right, is from the optic chiasm to the lateral
Sham.
geniculate nucleus, right, contribute to contralateral homeopsia, homonopsia, hemianopsia without macular sparing, so it would get the macule too. Okay, that's why it
Okay.
can't be the optic tracts. Lateral geniculate nucleus is in the thalamus for the visual pathway. A lesion in the lateral geniculate nucleus would also result in contralateral homeopsia, hemianopsia without macular sparing, so also gets the macula. Optic radiation, right, is from the lateral geniculate nucleus to the primary visual cortex, so right in between, would result in contralateral homeopsia is hemianopsia, but the pattern of visual loss depends on the specific location of the lesion within the optic radiation. So I think this is when you start getting some pie in the
Hmm.
sky kind of ordeals. So like a
Okay.
quadrant. So yeah, so best answer here is the primary visual cortex because it's macular sparing. So these are always
Okay.
you just have to kind of map it out. There's like a picture I think in first aid that kind of goes through it pretty well. So
Yeah,
you
there's a picture. There's a really good picture in first aid.
yeah, so you just have to kind of work it back and kind of remember like, oh, what lead because they like asking usually one question on this. They don't ask many, but if you can remember, it's an easy question. If you can't, then you only get one question wrong. But
Okay.
so just kind of take a look at that picture and kind of work the pathway of how vision kind of gets lost.